It's important for our patients to test their blood pressure at home, mainly because it allows them to see their numbers. And by seeing their numbers, they feel more inclined to be compliant, meaning take their medications.
So just because your blood pressure is high at the doctor's office does not necessarily mean you have high blood pressure. We need continuous readings from different times of the day. Once we get the numbers, we put it together, then we can see where your body truly stands and whether or not you have essential hypertension.
There are certain situations where we don't get the whole picture when a patient's sitting in our office. That's something called masked hypertension, meaning that in my office the blood pressure can look fine, but in reality, in their regular life, the blood pressure is really high. On the opposite end of the spectrum, there's something called white coat hypertension.
White coat hypertension is stage fright. Really, your blood pressure is elevated when you're in the doctor's office, but outside the doctor's office, your blood pressure is normal.
So I normally encourage them to buy a blood pressure monitor, and when they do buy it, they bring it into the office. When we check it in the office, it's going to be a manual blood pressure, meaning that we're checking it with a cuff and we're inflating it, whereas the ones at home are normally electronic. If the blood pressure monitor, when you bring it into the office, is very similar to the readings we're getting, the likelihood is it's accurate.
I think it's really important to speak to your doctor because there are many different monitors out there that you can choose from. It can be very, very overwhelming when you walk into the pharmacy. In general, we try to stay away from the finger monitors or the wrist monitors because we find that they're not as accurate.
I typically suggest that they check their blood pressure probably twice a day. The first blood pressure reading, which should be first thing in the morning, is likely going to be your lowest. And then as you go through the course of the day, stress comes on, you're walking, you're exercising, your blood pressure should probably get a little bit higher.
So you want to make sure that when you're testing your blood pressure, you're in a situation where you're not going to get falsely elevated readings. You don't want to do your blood pressure right after you ran a mile. You don't want to do your blood pressure right after you had a huge cup of coffee. You don't want to do your blood pressure after you had a fight with your boyfriend over the phone. You want to be in a situation where you're calm and collected. You can sit for a few minutes. You can set your arm up on the table.
I have patients that come in and say, well, I didn't take my blood pressure medication because my blood pressure this morning was too low. Or patients who say, I took double my blood pressure medication because last night my blood pressure was too high. That's not the way blood pressure works. Blood pressure medications are not as needed medications. Do not be afraid of the numbers you get. We're not treating the number, we're just getting a number to get data. Just think of it as more information for me to help adjust their lifestyle or medications.